I'm Stuart Adelson. I'm an adult, child, and adolescent psychiatrist, and I'm an assistant clinical professor at Columbia Medical School. I am also an investigator in the Division of Gender, Sexuality, and Health at Columbia, and a member of the organizing committee of its initiative for LGBT health. And it was my honor to serve as primary author of the American Academy of Child and Adolescent Psychiatry's practice parameter on LGBT youth. The American Academy of Child and Adolescent Psychiatry recommends that all psychiatric evaluations include information about these areas of life. These can be gathered both from the individual or from caregivers or other collateral informants as is appropriate. This can be done in a way that is developmentally appropriate to the age of the child or adolescent who's being evaluated and any clinical issues or areas of concern that they present with. And if an initial screening of these parts of life reveal any particular mental health issues or problems, they can be explored in greater detail by the clinician. Clinicians can take many steps to make children and adolescents feel comfortable discussing issues of sexuality and gender. These youth often have felt different or experienced stigma, sometimes for many years, and they may watch carefully for any signs of non-acceptance. Mental health professionals can help overcome that by creating a welcoming office environment through choice of reading materials, office decorations, non-judgmental forms, and welcoming staff behavior. And the American Academy of Child and Adolescent Psychiatry recommends that clinicians interview their patients in a non-judgmental and open-ended way that does not presuppose any particular outcome of development or convey the idea that one particular sexual orientation is preferable to another. Clinicians can do this, for example, by use of gender-neutral language. So, for example, in interviewing a teenage boy, instead of asking, "Do you have a girlfriend?" or instead of asking a teenage girl, "Do you have a boyfriend?" the clinician might say, "Is there someone special in your life?" Or, "Have you been dating anybody?" Or, "Is there someone that you feel drawn to? And if so, tell me about that person." And they can allow the youth to set the pace of disclosure of sexual orientation. Youth who are experiencing gender dysphoria or who may be transgender have particular needs related to their gender identity that's different from their birth gender identity. And clinicians need to convey a non-judgmental and accepting attitude for the experiences that these youth have as well. Family and community values play an important role in how adolescents experience and understand their sexuality. So it's very important for mental health clinicians to be aware of the family and community values that LGBT youth are exposed to, and especially aware of any points of friction that these may cause. Working with these youth may involve, in part, intervening in the family and community systems in youth's life. Transgender youth or gender dysphoric youth face a variety of special mental health circumstances and needs and developmental challenges. These relate to the difference between the individual's gender identity and their assigned gender identity based on their anatomy at birth. These youth experience many of the same mental health issues such as stigma and bullying that affect LGBT youth, in addition to the special issues related to being transgender. The mental health needs of these kids remains relatively understudied, and much more research is needed to guide the best practices in their care. But we have begun to learn a great deal about how to care for these youth. Being gender dysphoric sometimes emerges in childhood and sometimes in adolescence. Sometimes it goes away after a period of time, and sometimes it remains stable over the lifetime. The ACAP LGBT practice parameter contains special information on current scientific evidence on the best way to care for children and adolescents who may be transgender. Coming out is a very complex process, and whether or not any given youth should come out is a complex decision that has to take into account both the youth's maturity and the environment in which they live. For some youth, coming out can bring great relief. For others who are living in a hostile environment, the most adaptive strategy may be not to come out for some time, or even to remain in denial. And it really needs to be tailored to the need of the individual youth.